Thank you to the NPA for bringing leaders together across pharmacy, government and industry to share learnings, experiences and insights on the pandemic. As part of your supply network, we are committed to listen, act and improve to make sure we are best placed to deliver solutions that help you work smarter, not harder. Our products not only include our award-winning Pharmacy Manager PMR, but also Pharmacy Display, created to help enrich your marketing and engagement strategy with digital display screens and engaging content for effective in-store marketing, as well as our exciting new Pharmacy Intelligence Hub, providing a digital connection to your stores that offers real-time metrics accessible anytime, anywhere. If you'd like more details on our pharmacy solution, then visit our website at sedgdimrx.co.uk.
Welcome everybody. Welcome to the opening session of the NPA Conference 2021, which includes a keynote address from the Minister of Prevention, Public Health and Primary Care, Churchill MP, and a talk from the chair of the All-Party Pharmacy Group in Parliament, Jackie Doyle-Price. We start our conference today on the 73rd birthday of the NHS, and in fact on that day that the Queen has announced that the George Cross is being awarded to the NHS. NPA members are rightly proud of the enormous contribution they make to the NHS, and I know that the Minister will acknowledge in particular our members' incredible effort during the pandemic. I'd like to thank Lifebuoy, who are the headline sponsor for our conference. For reasons you will instantly understand, people are more concerned than ever about hand hygiene, which means it's a perfect time to partner with Lifebuoy. And Lifebuoy is back in the UK to help make hand washing and sanitizing a simple part of everyday routines. Later this week, they'll be hosting a session on consumer behaviour since COVID, which I hope you will really find really interesting. Before we hear from the Minister, I'd like to give you a heads up to the NPA's new plan for unleashing the potential of community pharmacy. It's called How We Can Help, and you're amongst the first to hear about it. With proper support from government and NHS, pharmacies can get help get the country through the pandemic, help the NHS catch up on lost ground, and be a foundation stone for preventing illness, managing long-term conditions, and access to primary care. Pharmacies have been central to the NHS response to COVID throughout, and you can be sure that at the end of lockdown won't be the end of the story of our sector's epic contribution. Integrating community pharmacy with the rest of health and social care will be key to delivering improvements. We aim to progress these ideas in an integrated care system with big ambitions to adopt a pharmacy-first approach and release the potential of pharmacy teams in this area. So please watch out for the launch of this plan later today and tell us what you think. I'm delighted now to introduce a specially recorded session from our Pharmacy Minister, Joe Churchill, who is the Member of Parliament for Bury St Edmunds and has been a Minister in the Department of Health since July 2019. Due to a late change in her diary, she couldn't attend the session live today, but I'm pleased to say that we were able to pre-record her speech and responses to member questions last Friday. In conversations with her and listening to her speeches, I've been impressed by her strong support for an expanded role for community pharmacy. I recall the roundtable meeting that the NPA held with Joe, the Minister for Vaccines, Nadeem Zahawi, and the Equalities Minister, Kemi Badenoch, back in January. And we had a really productive discussion about community pharmacy's role in tackling health inequalities, and particularly in increasing uptake of vaccinations in deprived communities. So let's now listen to the Minister's vision for community pharmacy and her answers to the questions posed by NPA members in the run-up to this week's conference. I'll hand over now to NPA Chief Executive, Mark Lyonette.
Thank you, Andrew, and I'm absolutely delighted to welcome to the NPA conference Joe Churchill MP. Good morning, Joe.
Hi.
Joe, as you probably all know, is Minister for Prevention, Public Health and Primary Care at the department. And so, of course, pharmacy is very much part of Joe's remit. And as I say, we're delighted that Joe's found some time to speak to our members and, of course, a number of key stakeholders online today. Now, as Andrew's just said, unfortunately, we're having to record this session on Friday, as unfortunately, at the last minute, the Minister's diary prevented her from joining us live on Monday. We have managed, though, to ask members to send in some questions in advance, and Jo's very kindly going to stay with us and respond to a few of those after her speech. But first, I want to start, Jo, if I may, with a big thank you. All of us at the NPA recognise, and hopefully some of our members recognise, what an incredible job the ministerial team have done during the pandemic. We know that we have differences, and sometimes they turn out to be small differences, but we do have a champion in you, we believe. We know that you battle for pharmacy behind the scenes and speak up for us. And so for all of that, Jo, which is often hidden to members, thank you so much. We are really grateful. And of course, just this week, there's been a fantastic example of that, with the announcement around the government going to cover COVID costs for the sector after all. And I know when you and I last spoke, Jo, that wasn't agreed. So thank you for you and your team for your part in getting that sorted. It's really, really important. Now, so I always think one of the really odd things about doing conferences online is there's no real welcome to the speaker, because normally there's time for all of us to applaud and clap, which probably sounds a bit strange in Zoom land, while the minister takes the stage and walks up to the lectern. So could I ask you, Jo, to get ready to give your keynote address to the NPA annual conference?
Well, thank you, Mark, for inviting me to speak today at the NPA conference. And hello, Andrew. We're still meeting virtually, but things definitely look different to when the previous NPA conference took place in November. We are now, hopefully, on our way out of this pandemic. And that is, of course, thanks to the vaccination programme, a programme in which community pharmacy has played an important role. You've already delivered over 5 million life-saving COVID-19 vaccines and continue to deliver in the region of 600,000 a week. Now, that's through over 600 community vaccination-led pharmacy sites. And you are at the heart of that national effort to vaccinate as many people in as short a time as possible. We know this is a race against the clock. Now, I'm proud of the role that community pharmacy is playing, not just in COVID-19 vaccination programme. You've helped to deliver the biggest ever flu programme in our history. Now, more than 2.6 million flu shots were given through the winter. And I know it seems a bit like a distant memory. We were right in the thick of it. So the fact that that programme was delivered and was record-breaking is phenomenal. And from the start of the pandemic, you've not just stayed open to serve your communities, but each and every time you've gone above and beyond. And people in my own constituency, but from right across England, talk to me about how they've been served by their local pharmacies, how much they trust the people behind the counter, how much they feel you care for their well-being. So thank you, because as I say, you've gone above and beyond. You've made sure that vital medicines have got to those in need. You've been there for people. You've worked incredibly hard to keep them safe. You also implemented the medicines delivery service and Pharmacy Collect and the lateral flow testing service, but services to support not only your communities stay safe, but to help us in government tackle this pandemic. I know that the past year has tested all pharmacies, and I'm looking forward to continue to work together as we progress the recovery of our nation's health. I've said it before, and I'll say it again, that I am personally committed to doing all I can to support community pharmacy. I believe that you have an essential role as part of the NHS family, that you bring amazing value to local communities. And as I say, you are trusted. I am, of course, aware of the remarkable effort from the sector and what that meant, and it meant that you incurred additional costs. As you know, last Monday, we announced that pharmacy contractors will be reimbursed for additional costs incurred during the pandemic. And today, NHS BSA has opened the claims process, and you have until the 15th of August to put your claims with payment claims in October. Now, I'm aware of the frustration that this delay on this announcement has caused to many of you. And I'd just like to say, I am really grateful for the patience that you've shown. And we have had some difficult discussions with Treasury, but I believe that the offer that we have now agreed with PSNC is a significant improvement on the previous offer. You can claim for more types of costs, and any business grants that have been received are no longer deducted from the claims. Now, I was really encouraged to read the NPA's plan for unleashing the potential in community pharmacy, and to see that it builds on the vision in the community pharmacy contractual framework. We're already making good progress on our journey set out in the CPCF to deliver more services through community pharmacy. We have the community pharmacy pharmacist consultation service with referrals from NHS 111 and GP practices. I would really like to see the number of referrals increasing significantly. We also introduced the discharge medicine service back in February, and I see that the use of this service has been increasing steadily ever since. All community pharmacies are now healthy living pharmacies, and this provides a great foundation for an even bigger role in prevention. Now, a renewed focus in the department post-pandemic with the setting up of the Office for Health Promotion is prevention. How we care for people before they are unwell, and how we care for them and make their journey with ill health easier by making sure we are there. We are, of course, negotiating with the PSNC for what the sector will deliver this financial year in year 3 of the CPCF, and I hope we can introduce more services and embed the ones that are already introduced. I'm pleased to see that your new report, of which I have a copy here, is for an even bigger role for community pharmacy. You've demonstrated how vital you are and how much you can help as part of that family of the NHS throughout the pandemic. And all of us here today know that you have the skills and the desire to do more. I agree with those 4 pillars that the NPA put out in the plan. We must use community pharmacy to help the NHS and the nation recover from COVID-19, and that includes supporting the COVID-19 and flu vaccination programme. We must continue the journey with the 5-year deal, build on the CPCS, and then explore what more community pharmacy can do. Community pharmacies are very well placed to do more on public health and prevention, and importantly, this can help level up the country, especially in the area of health that we know has such an impact on people's life chances, the work they do, and so on. And we must enable you to do more. And of course, we need a network of financially stable community pharmacies to do that. So to the future, we are on a journey to transform the provision of health and care, particularly out of hospital care in this country. That's the spirit that runs through the Health and Care Bill, the modernisation of our Mental Health Act, and the reforms that I've spoken of in public health. And underlying all of this is the idea that prevention is better than cure. Not a new thought, but one that we want to embed at the heart of what we do. So by working together to achieve better health outcomes for everybody, we help the nation and we help the individual. And I see communities sitting at the absolute heart of primary care, helping to prevent people from becoming patients in the first place. And then when they do, unfortunately, become ill, to enable them to use their medications effectively and to give them other advice. The Health and Care Bill provides us with opportunities to better meet local health needs. And I know that community pharmacy has already been engaging with developing new arrangements. We will work at the centre to incentivise integration, but local relationships are key. And I encourage you in the work that I know many of you are already doing in this space. We must see the large network of pharmacies across England as a central part of the integrated care system. I want to explore with the sector how we make this work. The NPA plan to unleash the potential of community pharmacy will help us do exactly that. And I look forward to those discussions. So in closing, I'd like to repeat the gratitude, not only of myself, but of all of those in the health department, and including both the past and now the new health secretaries, for the gratitude in everything you have done since the start of the pandemic. We're stronger. We're stronger because of you. Your communities are stronger. You have served them and cared for them. And we are incredibly grateful for everything you've done. Thank you.
Thank you, Jo. Thank you for that inspiring speech. Really, I think in terms of, I know members will appreciate the thanks that you've shared there. I would remind members as well that you and, as you said, the former health secretary have often spoken about the value of the sector during the pandemic, and I think that's always been welcome. That's always been well recognised. And also thank you for referring to our new publication this week in terms of how we can help, and hopefully it chimes with the vision for the sector that both government has and hopefully NHS England as well there. So now we've only got time for probably a handful of questions in the slot this morning, but the first question, if I can ask, is very topical. Yesterday, or remembering that we're recording here, last Thursday we had the JCVI announcement about the new booster programme, and I wondered whether you could, and you mentioned a little bit there in terms of the work that pharmacy's already been doing to contribute to that massive vaccination programme. Could you say a little bit more about your plans for making greater use of community pharmacy going forward?
Yes, and just to reassure you, because obviously the Minister for Vaccines who has indeed, we were talking only this week, and he too recognises the enormous value that pharmacy has brought and the further value it can bring to the programme. I want pharmacy to do more vaccines and more flu vaccines. Arguably, you are incredibly well placed to do both. Last year, as I said, you did more flu vaccines than ever before, and I want to see even more this year. And as you say, with the news that's come out this week, there's obviously there will be further instructions and so on as we go through, understanding what it means as far as administering vaccines at the same time and so on and so forth. But I expect that the number of pharmacy-led COVID-19 vaccinations will go up significantly. We're teetering around the 600. I would like to see that. And as I say, I discussed with Nadeem this week how much more value we can get and how much more we can drive those numbers up, not by 10, by hundreds, to make sure that we can really deliver through the pharmacy network, which is so key because, as we've discussed, it's embedded in communities.
Thank you, Joe. That's really helpful. Now, the second question, this one's from a member who's I think is clearly concerned about one of the things that perhaps hasn't gone so well during the pandemic, and that you'll know that in many parts of England, the GP community pharmacist consultation service is not yet producing as many referrals into the pharmacy as we probably all would like it to do. We've had several members saying, how does government see this? What do you see as the key factors holding it back? How could we accelerate the uptake of GP CPCS? And what do you think the solutions are, Minister? What might we do?
So I think it's twofold. I think we've got to encourage people to think pharmacy first. I think as it becomes a more natural for the patient to think that, oh, well, I'll go to the pharmacy just as readily as I would go to general practice. That is one way of driving those numbers up. But specifically with general practice, I've no doubt that COVID-19 has had an impact on this, thus far, on the rollout specifically. As we adjust to new ways of working, I want to see this referral route from general practice to community pharmacy really embed. We need GP practices to use the referral route more, because we know that it's only by treating that primary care family as a family and using the skills of all the teams, both in the pharmacy setting and in the general practice setting, that we can help the sort of volume and the sort of numbers of individuals who are seeking healthcare advice, assistance, and so on. So we need GPs to make sure that we're using this route more, so that we help them deal with more complex cases, that minor ailments find their route seamlessly into pharmacy. And then it not only uses the skill mix more effectively, and many pharmacy teams have spoken to me about how much more they feel they'd like to do, but also it uses resources much more effectively. So I will see what we can do from the centre to make sure that we actually drive this work forward. But I'd also like to see that closer working at local levels. I've seen places where it's working really, really effectively. And then I've spoken to others where they're perhaps having to ring a general practice receptionist, and there isn't that seamless communication going on at a local level. So these are ambitions that will be helped by the Health and Care Bill, but also it is really important that we drive these things forward at a local level, even before that has made its passage.
Yes, and I've got a question from a member here, which is a bit similar in a way, and it might be part of the solution in a way. So the question is, what plans does the government have to improve the transfer of information between different parts of primary care? And I'm conscious, I think this question might have been before the announcement last week, but the government just launched a data strategy, I think.
Last Wednesday, I think it was. Yeah.
What plans do you have to improve that transfer and flow of information between different parts of the system?
Well, I mean, if the pandemic has shown us anything, it is that the seamless flow of data from different parts of the system to help people access the care they need is something that can really help benefit the individual. So IT systems that are able to communicate with each other across the entire system enable all of us to, or rather you as professionals, to deliver that care that we have this aspiration to do across the system. Now, it's only when the information flows that we get that integrated care, but it is complex. And obviously there is a level of sensitivity to make sure that we do it well and that it's trusted. There is progress. Medical records are already shared between medical professionals to support locally commissioned services, and nationally pharmacists have read access into the patient summary care record. And when a patient has their NHS flu vaccine in community pharmacy, this information can now be sent electronically to the patient record in the GP system. Now, I know this isn't enough, and people have spoken to me about what more they want, what more they feel would drive efficiencies, what more they feel would help. So we're building on it. We're considering important issues around the technical requirements, around patient consent, and around data security. It's really, really important that all of us help people understand how much better and safer the service we can give is if we can use data carefully, appropriately, in order to plan services and in order to deliver to the patient what they need. So we're on a journey, and for me, pharmacy is very much part of that journey. We've seen electronic prescriptions, for example, go up pre-pandemic. I think it was 6 in 10, and now it's 8 in 10. That better use of technology through the system really does help us.
That's right, and I was talking to a member last week up in Manchester, where I live, and they were saying to me that, you know, the GPs had been giving them some feedback on the current system and processes, that it was so clunky for them to kind of engage with the pharmacy software and our solutions that actually it was very marginal whether it was worth them referring at all. They might as well actually see the patient by the time that, you know, they've done all of these things. So it does feel, I mean, there are other issues I think that we need to work through with GP CPCS, but one of them is definitely improving the, as you say there, the flow of data. And I think if, you know, as we look forward and we talk about pharmacy doing more, then, you know, it might not be critical today to have that perfect integration for things where there doesn't need to be such a detailed flow of information and so urgently. But the more we do, the more it's going to be important that those things are already in place. So there'll definitely be, looking at the data strategy and the timing of this, you know, it's not something that's going to land tomorrow. I think it's 2 or 3 years down the line, isn't it, really? But
yeah, but if you also look at your aspirations in your plan, yes, and the things I've said about, you know, the management of an individual's long-term conditions, you know, the role that you have that you have going forward as independent prescribers, all these things demand that better integration of data. So as I say, it is a journey, getting it right, making sure that people understand why it's beneficial is important as well, and that the transfer of or the sharing, rather, because I think one of the challenges is people often view it as similar to shopping, that you pick it from one place and you take it to another, rather than just you being able to see it, so that you can actually, that it's kept in it, if you like, in a trusted environment, in a locked box, but you can have a look at it so that you can give that best care, is where we want to get to, because that is optimal, particularly when you look at things like Keith Ridge's review, and some of the statistics that we know around some prescribing challenges that we've got, how we can best help people do that.
Absolutely. And the final question I've got, Joe, is well, it's almost a personal one for the former health secretary in a way. I think many of our members have said to me that, you know, they're disappointed in a way that Matt has now resigned. Not really just because he's been such a champion along with yourself in terms of talking and sincerely talking about the value that pharmacy has brought, not just during the pandemic, but before the pandemic even happened. I remember taking him to a pharmacy in his own constituency quite soon after he was made Secretary of State, and even then I think he got it. And you know, I think there's possibly a little bit of a worry with some of our members that, you know, will the next Secretary of State also get it? You know, Matt would talk, for example, about, you know, pharmacy becoming the front door to the health service or the first port of call for healthcare. Can I ask you, with Sajid Javid now in place, do you think that sentiment, that vision will continue with the new health secretary?
Yes, I do, because I believe that the vision that's set out in the CPCF is that pharmacy is that first port of call for minor illnesses. You sit at the heart of primary care. You are influencers, you are flexible, and you are absolutely essential in giving people advice, keeping them healthy, and making sure their medication is effective. As a government, we are committed to it, and I know that already the new Secretary of State and I have had conversations about pharmacy and its value to the system. So I'm sure that commitment is there. And I also happen to be Matt's parliamentary neighbour, so I will take your kind words back to him, and I can assure you, you will still have a champion there in him for pharmacy.
That's really good to hear, Joe. Now, unfortunately, that's probably all we have time for today. You mentioned the health bill in your speech there, Joe, and obviously that's going to make it a very busy year for you and colleagues. I just want to say we'll do our best to play a full and really constructive role in that where we can as that goes through, particularly the discussions around the future of pharmacy. And maybe
that comment slightly made me laugh, Mark. I apologise.
Oh, okay.
In so much as you're inferring this will be a busy year, as if the last one hadn't been.
Yes, of course, indeed, it's been extraordinary.
The last one was busy in a way that I truly hope we are now travelling through with the vaccination, so that we can get on with some of these, just some of the phenomenal innovation that has come through. The pandemic has, and a lot of healthcare and a lot of professions feel that an awful lot of innovation and a lot of things have 10 years advance has happened in this past year. So now making the most of that is what's really key.
Fantastic. And maybe we could finish, Joe, on a lighter note, and conscious that we remind all the viewers that this is actually Friday and you're watching on Monday. Would you give us a prediction for the England-Ukraine game tomorrow night? Are you a football fan?
No, but when the World Cup's involved, because I was gaily having a conversation. I perhaps ought to defer to Chris, who's with me here, who's in my office, because he's a big football fan. I'm going to go for a win. We should, on paper, have a win. And anyway, it's I live my life trying to be positive about everything, and you know, it's coming home. Let's just all remember that.
I promise you, Joe, that if you're right, we'll play this section, and if you're not, we'll probably edit it out.
Yeah, scratch it out.
If it all goes terrible.
as my granddad, who used to sit and do the coupons every Saturday, would say, we've got two chances, haven't we? So win or lose.
Well,
thank you very much.
could I thank you again, Joe, for not just for turning up today and talking to us, but also for your ongoing support for the sector. Thank you very much.
You're welcome, and have a good conference. Take care.
Thank you, Joe. And obviously, they played that clip because obviously England won on Saturday, so that's absolutely fantastic. So thank you, Minister, and I'm delighted now to be joined by the chair of the All-Party Pharmacy Group, Jackie Doyle-Price. Jackie was elected Member of Parliament for Thurrock in 2010. She's been a government whip and a minister for suicide prevention and mental health. She's now the chair of the All-Party Pharmacy Group, which has shown itself to be particularly influential and a strong supporter of the role of community pharmacy in the past few years. So I'd like to just now hand over to Jackie. Welcome.
Thank you for that, Andrew. And I'm very pleased to be able to join you today at this conference and indeed to follow an excellent address by the Minister, which I couldn't disagree with the words she says. So we in the All-Party Group will be looking forward to working with her so that we can deliver the sentiments and messages that she's delivered in terms of how Department of Health sees the role of pharmacy in the delivery of our NHS. And I'd also like to just thank everyone for their endeavours over the last year. And I think right now, I think both the public and the political establishment are fully recognising the contribution of pharmacy to our nation's health. And that has been written large throughout the pandemic. I think everyone noticed that pharmacies were open for business when GPs were closed, and that was often the most accessible form of health advice. And actually, you know, the public are rational and fair and generous, and are fully pleased to be able to give you the support. And perhaps more than ever, we cease to take you for granted, and we are fully appreciative of everything that you do. So thank you. Now, we all know that this has not been without costs for many pharmacy businesses across the nation, and I am very pleased that finally an agreement has now been agreed with the Department of Health and the NHS to ensure that none of you are out of pocket because of the efforts you've made to fight the pandemic. I know it's taken a great deal of time, as Jo alluded to in her speech, but I hope now that we can just resolve that to everyone's satisfaction and really look forward, because I'm very pleased to see that ministers are finally recognising that pharmacists are very much part of the NHS family. There is more that can be done in the delivery of primary care by pharmacists, and really we want to hold them to that delivery. So I'm pleased that we can really shift the conversation more towards what the future looks like rather than arguments about the past. But I do recognise that that was a very important issue, and we in the All-Party Pharmacy Group are very pleased to air the concerns of the sector about those financial issues. So I think now, having reached that sort of line in the sand about the past, it is important that we take advantage of the conditions that we now have to really settle a strong future for the pharmacy sector. A future which really places it firmly at the heart of our NHS and harnesses the very direct relationship it has with patients to deliver better health services. The truth of the matter is that the relationship that a patient has with their pharmacist is very different to the one that they have with their GP or any other medical practitioner for that matter. It's one that's less intimidating. It's one that is just more comfortable. Quite often we know that conversations between patients and medical professionals don't always go very well because there's an element of deference, which I think is because of the accessibility of pharmacy is much less threatening, and perhaps we can utilise that relative informality in how we access the service to great effect by encouraging honest discussions between patients and medical professionals. So we can just take advantage of that accessibility. And really, this is exactly the time to be doing it. As we know, the pandemic has led to a backlog in the demand for services throughout our NHS. And that means that every part of the NHS needs to play its full part in dealing with that. So we really do need to make sure that when it comes to delivery of primary care and dealing with that backlog, that pharmacists are empowered and resourced to do exactly what they can to help support GPs and the wider health sector in dealing with pent-up demand as well as current demands in our NHS. And the figures speak for themselves. I mean, I don't need to remind any of you on this conference that, you know, community pharmacists dispense 1 billion prescription items every year, and that pharmacists deliver healthcare advice at a rate of 48 million consultations per year, saving 500,000 GP appointments and 57,000 A&E visits every single week. I don't think we can repeat those numbers often enough, because I think those numbers tell everybody just how big a contribution the sector makes. And I would like everybody involved in decision making, everybody involved in the Department of Health, everyone involved in NHS England and in CCGs, in our integrated care systems, I want them all to know those figures, because it's only when you recognise the full contribution that we can really reflect what decisions we should be making to support you all. Because we do know that there's a culture within our NHS and the DHSC which is inevitably going to favour those organisations for which it is directly responsible rather than for those to which it contracts. And we just need to be completely reminding everyone of the contribution that you make. And I've said it already in this speech, but I'll say it again because I can't say it enough either, that our pharmacists are part of the NHS family. And just today, Her Majesty the Queen has given the George Cross to the NHS. Now, in strict terms, the NHS is simply a contract between the state and the subject to provide free healthcare. But the reality is that the NHS is the people who work in it. That's who we think about when we talk about our NHS. And that includes every one of you. So I still think we do need to do more to remind NHS England and the Department of Health that pharmacists are medical professionals. I still think there are too many in the health establishment who see pharmacists as glorified retailers, and you are most certainly not. You are medical professionals, you have a real skill, and it's a skill that needs to be properly valued by the establishment. And indeed, it's something that needs to be promoted if we are to continue to have the pipeline of trained staff to work in our pharmacists. And that becomes even more necessary if we are going to make better use of the sector in terms of delivering primary care. I can advise you all that you do have phenomenal support across Parliament. Earlier this year, I did bring a motion to the House to support securing a fair settlement in terms of the COVID costs. And I can tell you that the support I had from members across the House was quite phenomenal. I've never seen so much support being put towards the request I put in for that business. So you are, you do have very many friends in Parliament, and I would encourage you to take advantage of that and make contact with your MPs because they're always keen to hear from the coalface, particularly about NHS issues. And you will find that they will want to work in partnership with you and support anything you wish to do. Sadly, the debate wasn't as well attended as it might have been due to social distancing, but I can tell you that there were many more in spirit. So in terms of what we can do in the all-party group on pharmacy to support that stronger future I've been calling for, I'm currently giving some thoughts to what our future programme will look like. We have a forthcoming annual general meeting in which I will get the support of colleagues to deliver that. But essentially, I want us to be really leading the agenda in Parliament, the debate in Parliament about what will constitute a strong future for pharmacy in the wake of COVID-19. And we will be inviting evidence following our AGM in support of that. And I know the APPG has already been doing much work on this, and I'm very keen that we amplify some of the messages that you've already talked about today in our work, which I think is an excellent foundation, and probably it's an opening for 10 in terms of the debate that we need to have. But essentially, some of the things that we will be looking at getting evidence on will be making the most of pharmacy in the delivery of primary care, which is the overall theme, indeed, of our inquiry. We want to explore what more can be done to make greater use of pharmacy and diagnostics. And again, I'd really welcome some feedback on that from all of you. As I've already mentioned, I'm very concerned about recruitment, retention and professional development of the profession. And really, we do need to make sure that we are championing and valuing the skills and capabilities if we are to encourage people to look at pharmacy as a career option. I'm also very keen to highlight best practice across the 4 nations, and also within that, within individual PCNs within England. We can always learn from best practice, you know, I think too often there's a lot of energy spent in the public sector on reinventing wheels that already exist very successfully elsewhere. So we need to make sure that we are all sharing our expertise. And finally, I would also like to look at the whole issue of pharmacy and patient safety. We know that inappropriate use of medicines can cause harm to patients. We know that prescriptions can be advanced without full knowledge of a patient's history or comorbidities. And we know that pharmacists are very well placed to institute those medicines reviews, which could actually be really give real improvements to people's health. So I think, again, I really welcome the NPA document, How We Can Help. As I say, I think that's a useful start for 10, and I hope we'll be able to have a discussion within the APPG about what you said there. Really is a scene setter before we undertake our inquiry. And I hope that by the end of it, what we can come up with is a kind of collective manifesto, which is a call for action to everyone to make sure that we deliver a strong future for pharmacy and one that fully harnesses its ability to deliver the best possible health outcomes for everyone in our nation. But I think that's enough from me, but I'd really welcome any questions from you. Thank you.
Many thanks, Jackie. As ever, eloquent speaker, and also really appreciate you coming on to the conference to answer any questions our members might have. There's a couple have come in on my WhatsApp, actually, surprisingly enough, and it relates to what you've actually just said. First one is, how should pharmacies engage with their MPs in order to gain their support? So you mentioned this is obviously quite key, but how do you think they go about that locally? What's the best sort of routine?
Right, well, the first thing is don't be shy. always the first thing, because obviously MPs do get lots in their inboxes, but there's an awful lot of, round robin emails, lots of nonsense. MPs, I promise you, are always keen to hear from real people with something to say. So I would encourage you to write to your MP and ask them to come and visit you. It doesn't need to be anything fancy. Actually, we just like to see what people do. We like to see, what the impact is. And I must admit, when I visit my pharmacist, I just sort of stand in the shop and have a chat, and everyone can see us. And it's just nice to be able to pass the time of day with constituents as well. So that's always something we enjoy doing. So I would just say, just don't be shy. Write to your MP, invite them to come and see you, and just have something you'd like to say to them. Have a key message, which is probably how many people you've been seeing, how many pensions you issue, prescriptions you issue. Tell them the good news stories about stuff you do about delivery and going to see what you do for vulnerable patients, because quite often we don't know any of that. And anything different that you're particularly proud of. We just want to hear, and we'll always champion you, because it gives great local colour. Every time we stand up in the House of Commons, it is really nice to be able to point to a constituency example, a real world example, but it's only if you engage with us we can do that.
Yeah, that's good advice, Jackie. Thank you. And I think obviously to what Joe said as well, maybe using data in that conversation locally. So that's really good advice. In terms of a couple of questions that have come in, you may well have seen them. Alex Phillips, who's a journalist at the Chemist and Druggist, has got a couple. Joe said, the first one, Joe said that during the pandemic, pharmacies had demonstrated how vital we all are, and that the country needs a network of financially stable pharmacies. What is the government doing to ensure we have a financially stable pharmacy sector when we know pharmacies are closing? And that's echoed actually one of my WhatsApp questions. So I've got two questions along a similar sort of theme there, really, Jackie.
Yeah, well, the first thing I would say is, you've just heard from Joe, and obviously when Matt Hancock was Secretary of State, he made very positive efforts. So there is a genuine acknowledgement of what pharmacy can bring. But again, a lot of this is also caught up with how the service is commissioned and the role of NHS England and ICS. So to an extent, ministers are playing catch up, really. We as politicians and ministers are giving a very clear message about the value. But in terms of the sustainability, a lot of this is legacy of previous financial arrangements and agreements and so on. So this is where the real discussion about the future is so important, because what we need to do is give a very positive, unarguable offer to the NHS to say, look, this is what we can do for you. This is what what your demands are, and this is this is the best possible way of delivering what you require, and at really good cost. And it's actually got to alter that conversation, because I think, quite often, the real message gets lost in translation. And again, this is why we've got to this position where, the NHS England, Department of Health do see this as a retail question, when it is not. You are medical professionals. So you've won the ministers over, and you've won MPs over, and we will carry on pushing those messages. But I think, we now got to get into the real nitty-gritty of negotiation with commissioners about how you can deliver that service, and that is a commissioning point. That's not a leadership point.
Right, and the other one that goes, I think you mentioned workforce, and this has also come in. It says that Jo also said that she wanted to see more pharmacy services, including in the next funding plan. But currently, there's a shortage of pharmacists in the UK. How does the government intend to have more services when there isn't the staff or the workforce to run them? So that's clearly a live example of what you just described there. We're going to need a workforce, and there's obviously concern there that we perhaps haven't got the number of people out there to deliver the services that we now aspire and the government aspires to provide.
And again, this is where the leadership point is really important, because you don't attract people into a career stream, unless they can see a future. And obviously a lot of the noise that we've been hearing about the sector and about closures and so on, that isn't going to help attract people either. I know, to be frank, Jo was the first person to discuss this with me, this particular aspect, more than before anyone in the industry, to be brutally frank. So it's something that she's been acutely aware of, and I think she wants to think very creatively about that aspect, actually. So again, if we've got any interesting ideas, I think she'd be first to explore what we can do to support them. But it's also worth saying that actually workforce is the biggest challenge for every part of the NHS. It really is. And I think we have this way of debating the NHS, which is all about inputs and not about outcomes. I think if we have a more outcome-focused discussion about the NHS, actually it makes the case for pharmacy in any case, just because of the efficacy of delivery there. But one of the problems we have is that our ability to train within the UK medical professionals of all types does not keep pace with our demands for more resource for the NHS, which leads us to looking elsewhere across the world for medical professionals. But again, we've just got to make sure that people can see a future and that they can decide to pursue this, because it will be an attractive and rewarding career for everyone who chooses it.
Okay, I think again it's probably workforce related, certainly financially. And Mark Brooks has put in the questions: to provide these services, we need more financial support to fund ever increasing wage costs, especially with the national living wage. So what are the sort of thinking around that? Now that question's just gone off the system. I've lost the end of that question, but I think the general theme was how do you see us funding that shortfall in the wage bill effectively?
I think, well, I mean, ultimately, we have to make sure that you're fairly rewarded for what you do, and that is what is a fair financial settlement, but also one that's sustainable. And you know, it's not really for me to sort of get into the detail of that. That's something that needs to be done contractually. But you know, I think we need to be realistic. If there are a number of policy decisions that have to be made about that, because if we are going to look at pharmacy to do more, then we've got to look at how that is rewarded through the NHS, and that's probably quite a holistic discussion, actually, given the complexities with which primary care services are commissioned and how you're rewarded and how that interacts with the whole issues around prescriptions and so on. But that's why it's so important we have this debate about the future and what you can do, so that we actually make sure that the NHS establishment has those considerations rather than just carrying on the way they always do.
And that same person has basically said the 5-year flat funding does not provide enough support. So how do you see perhaps the challenge in what we face over the next few years before that 5-year deal runs out? That how do we get these services off the ground? How do we fund some of that in a flat funding scenario?
Well, if you're doing anything over and above what is expected to you, then that should come with additional funds. But again, you know, this is where the way that government works, you know, we can agree something, but actually you only deliver it 2 years later, by which time the positivity or negativity of the message is lost completely, which is why we always, you know, I say everyone has to be ahead of the game. And I think, you know, as a sector, you know, getting your representations in at the right time to influence these discussions is actually really, really important. And I guess it's slightly complicated for the pharmacy sector because there's multiple organisations involved in it, and in a way that's just not the case with GPs. They can speak in a much more coordinated fashion. But I think if you know, you've obviously had a really good set of success over the last 12 months, which has given you some degree of success in terms of how to make representations. So carry on like that, but with a good forward thinking, you're more likely to get to where we need to support our pharmacies.
Oh, that's fantastic advice, Jackie, and really, you know, thank you for answering those questions. I've come to the stage now where I think we're at the end of the session, and I'd just like to thank our two speakers, the Minister, obviously, Joe Churchill, and Chair, as we've just heard from, Chair of the All-Party Pharmacy Group, Jackie Doyle-Price. Later today, we've got two further sessions. There's one at 6:30 with Lisa Simpson, who's Deputy Director of Community Pharmacy Strategy and Contracts at NHS England, and she'll be talking about the integration and new services in community pharmacy that we've obviously just heard Jackie sort of talking about. After that, at 7:30, Simon Dukes from the PSNC and NPA board member Jay Badenhorst will be discussing securing the right representation for community pharmacy. And our conference continues through until Thursday, with several sessions every day. So please join us for as much as you can of those sessions, and don't forget that all the sessions are recorded, so you can always watch them on catch up via the NPA website. And I'm sure that'll be particularly relevant for Wednesday evening, when I'm not too sure we might get many people watching us on NPA TV, but the people who can watch us then back again on the Thursday, hopefully with another successful England result, we'll be seeing them at the end of conference on Thursday. So once again, Jackie, thanks very much, and thanks to Joe, and have a great afternoon and the rest of the week.
Thank you.